There are so many questions about Medicaid, and I think there are so many misconceptions as well because we're not sure exactly what to do if we want to get our parents involved.
What are the steps? When do you start? All of that,
Mm-hmm.
and who can help you?
Exactly.
Today we're bringing in Keith Ludy and VC Spear from Barnett and Ludy Law Firm. Thanks so much for being with us. We are going to turn to you to help us understand this.
Thank you. Glad to be.
We have learned so much just
For sure.
as we've been going through, but it is a tricky, complicated process and something that most of us have never done before. So let's start with VC or Keith with just that kind of a brief overview of what Medicaid is and its role in the care for aging parents, potentially in nursing care.
Sure. Medicaid is it's a program that's funded 60% by the federal government, 40% by each state. Each state has their own version of Medicaid. And the purpose of Medicaid is to help people who have reached the level of care where they need 24-hour care, so typically higher than the assisted living level of care, help them to afford it. Because as you might imagine, the cost of 24-hour care is quite high. And, people especially people who are living on a retirement budget, can really struggle to come up with the funds to pay for that level of care. And over the years that we've been working and helping people with Medicaid, VC and I have noticed many things kind of out there, information that comes to our ears that we look at each other and think, boy, there's some misconceptions out there about Medicaid. So hopefully in this segment today, we can clear some of those things up.
VC, what are you seeing out there that doesn't seem like it's the right process? And first, let's share your many years of experience with Medicaid policy.
I worked for the state of Texas for 20 years in the Medicaid program, and then I have been retired and working for attorneys the past 14 years. And the Medicaid for Nursing Home program is a very complicated program with many rules. And so it's somewhat difficult to understand.
Mhm.
And but it's very positively impacting our families that meet those requirements.
Yeah. But because it's so difficult to understand, is that the reason why you have to be careful about the advice that you get?
Oh, absolutely. Absolutely.
Because
Because
go
you
ahead.
know, well, many people think that that they have to spend all their money before they meet the requirements. So that's not the case at all. So it helps for them to come even, long before they need help,
Mm-hmm.
to come and let's make a plan with them so that we know what their requirements are and they also know what the rules are,
Yeah.
providing for them to be able to get the benefits when at the time that they need them.
So what are the problems that you're seeing out there?
Well, some of the number one problems are listening to people that aren't professionals give them advice and telling them that oh, you have to be broke to qualify for Medicaid. And that's one of the main problems with it. And so if they don't come and find out that they don't have to be broke, they may be whittling down and selling all their assets to continue to make those installments every month to care for their family members.
Why is the application process so difficult and confusing?
Because I could technically go do it myself with my mom or have my mom help my mom, but it's very easy to not get it right.
Yeah.
Isn't that correct?
Absolutely. And I've worked in other Medicaid programs, but their rules are much simpler than in the long-term care policy. And the long-term care, of course, it's a big budget item, very, very much, but it is it has very definite rules that are they're usually a pleasant surprise when they find out what the actual rules are and that they don't have to be broke to qualify.
Now, Keith, if I apply for Medicaid and or help my mom apply for Medicaid, and what do you see when things come back and maybe it's not a simple process, and do I, if I get rejected, do I, I don't know what to do.
Exactly, and there are many people out there who will kind of try to navigate the Medicaid waters by themselves, and you're certainly free to attempt that. We've seen people actually successfully do it, but you're right. There's a lot of things that can trip you up, and um, when Medicaid is not happy with what you've submitted, they'll send you a rejection letter or something along those lines, and it doesn't contain a whole lot of information that you can really try to diagnose and figure out, well, what is it that we need to do differently? And I've talked to many clients over the years who've tried this, and they then will try to contact Medicaid and say, hey, how come you rejected our application? What is it that we need to do? And the standard response, and I completely understand why they would get this response, is we can't give you legal advice. And so there's sort of a stalemate there between people saying, well, look, we'll give you what you need if you'll tell us what you need. And Medicaid is saying, well, it's all in the rules. We can't help interpret them for you.
Mm-hmm.
So when a person, a company, a group offers advice to you to help you, what are the red flags we should watch out for?
Yeah, we hear a lot of stories about people who their loved one goes into a skilled nursing facility to receive a high level of care, and sometimes the individuals who work there, who I'm sure that they're well-meaning, will offer some level of expertise and say, oh, we can help you through the Medicaid process. Uh, Unfortunately, VC and I've seen many, many times that the advice that they're getting in that situation is, way off course.
Hmm.
It's not. I'm not trying to criticize people who do this wonderful job for people, but if they're not specifically trained, and if they're not attorneys, if they're not elder law attorneys, financial planners, people like that, their advice is well-meaning, but it really can, as VC mentioned before, people start being told that they need to sell off all of their assets or something like that. And so it's very tricky. You have to be very careful, like with anything, that the people that you're getting advice from actually do this, on a regular basis.
We hear a lot of times people in our community talking about mom is Medicaid pending. What does that mean?
VC, you want to take that one?
Yes, that means that there is an application pending to Medicaid for approval. And unfortunately, it's not a fast process sometimes. That's another benefit of working with us, is that I do status checks on them frequently to see if they're mired down somewhere. The rules say that each application must be processed within 45 days to meet the federal and state guidelines.
Mm-hmm.
That doesn't happen very much.
Oh, gotcha. So even though it says that it really doesn't happen within 45 days generally?
Oh, no.
And who's paying in the interim, as
Yeah.
far as, is that something that the family or the senior is paying for?
When they're Medicaid pending, I calculate what their monthly payment would be on Medicaid. And that involves how much income that they have coming in and the deductions that they get to take off. So that's actually what the state requires for them to be paying for their care, because it's not a free program.
Yeah,
sure.
What income you have is payable to the facility, and that's what they start out paying, and while they're Medicaid pending. And then when the Medicaid application is completed, then the paperwork comes back and pays the facility the difference between what their payment is and what the cost of care actually is.
Okay, so they backdate it, if you will, and from when
Yeah,
the application
yes,
was filed.
So during that
yeah.
process, do they have to worry about being evicted or being kicked out and losing their spot in the long-term facility?
They should not have to worry about that. What they what they're required to do when they're Medicaid pending is to again pay it. Medicaid is a pay what you can program, and so they should be paying, their contribution amount, and the facility should be waiting for the Medicaid process to be complete and then get the big back check. We
Mm-hmm.
do hear stories though from time to time about, I don't know if and I don't think this is most of the facilities, so it's just a
Right.
few that maybe don't understand that they are the ones who have to wait on the big check to come, because we hear stories about places that will tell the family, no, you guys need to pay the full amount and you're waiting on the reimbursement from Medicaid.
Mm,
And we'll take calls about that from time to time, and we tell the families, no, you pay your contribution amount, the facility is supposed to wait. And on 3 occasions that I know of just over the last couple of years, the response from the facility has been to tell the family, well, we disagree, and so we're going to give you a 30-day notice of eviction.
mm,
We're going to kick your loved one out. To which, that's also not something that they can do. And, we typically can handle that. But it's distressing because of the level of anxiety that can cause a family
sure.
if if they suddenly are in panic mode because they think their loved one's going to get kicked out when they're actually doing what they're supposed to be doing.
Yeah.
Mhm. And if you are,
Yes. And
go ahead.
recently we had a facility, and they want to get all of their money up front. It's just that that's not the way it works. And
Mm,
so we had a family that were told that they had to pay the full price,
mhm,
and then they could file Medicaid to pay them back. Well, that doesn't happen.
mm,
They're not licensed with Medicaid, and Medicaid is never going to reimburse them because they don't have a Medicaid contract.
Wow.
mm,
The facility is responsible in the event that they go that extra mile and decide to pay that amount. The
mhm,
facility has the money
mhm,
and they owe it back to the family. Well, we've seen where the facilities have changed hands. They've been bought by someone else, and then they say, well, you didn't give the money to us. You gave it to
mm,
that other facility that used to be here. So they end up, just doing dreadful things to the family's
mm,
finances when. And maybe they say, well, I want to go to this one because it's closer to home. So I'll just pay the full price,
mhm,
and it just doesn't work out well.
mm,
They just never get their money back, or they say, well, we have to send it to corporate, and corporates will give it to you in 40 days.
mm,
Well, they didn't allow them to take 40 days to pay it. So
mhm.
it's just never a good deal.
Yeah.
That just never works for anyone.
Well, and I think that's the hardest part about is that if I've never applied for Medicaid with my parents before, I don't know. I'm having to kind of rely on the people that I
Who
look
seem to be
to.
experts.
Yeah. So what would be your biggest piece of advice for people who have a loved one who needs that long-term nursing care, that 24/7 nursing care, Keith, as you mentioned earlier? What is the best advice for how to get through this process?
Here's my best advice. I've got a pretty good mechanic that works on my car when it needs to be worked on. I don't go to my mechanic if my elbow hurts,
Mm,
right? I go to my doctor. Just be careful who you're taking advice from. There's a lot of bad information out there on the internet. There's a lot of bad advice, just even within the whole elder care community. There are people out there who do know how the rules work and how they're supposed to work. Typically, again, those would be attorneys, financial planners, people who, that's what they do every day.
mhm,
So if you hear something, you don't always just assume that, consider the source.
Yeah.
Don't always assume that what you're hearing is correct. The right information is also out there. There's a lot of good people who will sit down and explain and take the time to make sure that you understand what the actual rules are in your state, what your options are, because if you take the bad advice and, like VC was referencing, and start selling off all of your stuff, I mean, it's gone. You can't get it back. So ounce of prevention's worth a pound of cure.
Mm-hmm. So if, because we see this in the community all the time, where somebody will have a loved one in skilled nursing and the skilled nursing facility will offer to assist them, that's a concern.
Yeah, that's a big concern, because for a couple of reasons. First of all, if the facility is the designated payee, meaning they're the one who's supposed to be getting the Medicaid check, for them to be offering advice of any kind regarding the Medicaid process is a massive conflict of interest to begin with. And also, to my knowledge, in my years of doing this, I've never met a person who works at the facility. They're great at what they do, and credit to them for that. But I've never met any who also have a license to practice law. So if you're giving legal advice and you don't have a license to practice law, you're stepping out of your lane.
Yeah.
Mm-hmm. Okay.
Yeah. It just seems like wherever you are in the process, application, the waiting period, eviction process, go find a good attorney in whatever state you're in and get that good advice.
Right.
Yeah.
Right.
Absolutely. Absolutely. And different states adopt different parts of the SSI rules, the federal guidelines. So don't listen to someone in another state tell you
Yeah.
what their Medicaid is like, because that's not Texas.
Because it's all
And
different.
Texas rules are very different.
Gotcha.
Yes.
Yeah.
Okay. Every state's got their own, just to make things more complicated,
That's
right?
Yeah.
Yes.
Right.
Yes.
Well, Keith and VC, thank you so much for all your advice and for hopefully clearing some things up about Medicaid.
That's right. Yes.
Yeah.
I think there is often a lot of confusion, and I think sometimes I find that the more I learn, the more questions I have.
Yeah. Thank you both. Yeah, I think the biggest thing that we learn from this is to get the good advice. Like Keith said, you're not going to go to the wrong type of expert to get the expert advice.
Right.
You want the expert in that
Right.
field.
Right. Even when people are very well-meaning and want to be able to help,
Sure.
they may or may not be the person for the job.
Exactly. Hey, if you have any other topic you'd like us to discuss, please let us know. Parenting aging parents.